when we try to think about what carbohydrates are, the main important thing is just thinking about the breakdown of carbohydrates. All carbohydrates are going to break down to sugar, right? But then it's important to really emphasize the different types of carbohydrates.
Are you ready to transform the way you communicate about nutrition with your patients? Welcome to Exam Room Nutrition, the podcast where the worlds of nutrition, medicine, and communication collide. Whether you're a seasoned physician or a healthcare student, this podcast is for you. So stick around and let's make our patients healthier, one exam room at a time.
Welcome back to the Exam Room Nutrition Podcast. I'm your host, Colleen Sloan. I'm a registered dietitian and pediatric PA. So we're tackling the topic of diabetes today, and we're focusing on helping our primary care providers navigate some difficult questions that might arise during your routine well checks. I'm so excited for our conversation today because diabetes impacts so many of our patients, and it can be really overwhelming trying to provide helpful education during a busy clinic day. But boy, are you guys in for a treat, because our guest today is Madalyn Vasquez. Madalyn is a registered dietitian and diabetes educator. Madalyn is also a certified insulin pump trainer and has helped educate patients on the advances and advantages of using diabetes technology. She has her own private practice and also runs a social media brand, so you can follow her at diabetes.rd. Madalyn, welcome to the show.
Hi, thank you so much for having me today. I'm very excited for our podcast recording.
So let's jump right into once a patient is diagnosed with diabetes, let's say they're managed just with PO medication only at this point. Guide us on what the primary care physician should focus on from the beginning. Is it carbohydrates or sugar or fat or portion control? So where do we start so we don't overwhelm our patient who's newly diagnosed?
I think this is a great question. Oftentimes I feel like the biggest thing is just telling that patient, hey, here are 3 things you can work on in the meantime before you go see a registered dietitian to get more additional support, right? And it could be something as simple as asking the patient more about their meal consistency. Are they eating 3 standard meals a day? Asking them, are you cooking meals or are you dining out majority of the time? It could be something as simple as, what do your portions look like? Are you adding vegetables to meals? So think of it as more of as a bite-sized recommendation, but not something that's going to totally overwhelm that patient.
Madalyn, I love what you said because that makes it feel less overwhelming for us as the clinician as well, that we don't have to provide them with a huge diet plan and a meal plan really right out of the gate. And I love that suggestion of maybe giving them 2 or 3 things to think about and work on before actually sending them over to you or following up with us again. So let's talk a little bit more about carbohydrates. As clinicians, we know that there's a role in diabetes. We have an idea for what carbohydrates are, but how can we educate our patients on choosing the right ones? Are there good? Are there bad carbohydrates? How can we frame this discussion to be more helpful for our patients?
When we try to think about what carbohydrates are, the main important thing is just thinking about the breakdown of carbohydrates. All carbohydrates are going to break down to sugar, right? But then it's important to really emphasize the different types of carbohydrates. We have your sugars, which are mainly related to those like cookies or baked goods, those added sugars, which I like to refer them as. And then we have our starches, which are going to be your potatoes, your white rice, or your white pasta. And then we have our whole grain fiber carbohydrates, which are going to be the high fiber carbohydrates like your quinoa, your starchy vegetables, your whole grain pasta. And it's important to understand the difference because these carbohydrates impact the blood sugar differently, right? And when we approach it from that perspective and we're explaining to patients, hey, if we focus on the high fiber carbohydrates, the high fiber carbohydrates are going to act as more as a buffer to our blood sugar, and they're going to help delay that rise in blood sugar in comparison to, let's say, when we're eating our starches or those added sugars, we're going to see a significant rise a lot quicker in the blood sugar rather than when we have the high fiber carbohydrates. So that's what I like to focus on when I am talking about carbohydrates is what are the different types of carbohydrates and how are they impacting the blood sugar? Because we do know that they're all going to break down to sugar.
That's awesome. And I love that you distinguish and educate them on the different types of carbohydrates because people like to just lump them into one. And that's not true and how it plays in our body and how it affects our blood sugar levels. So I think that's a really good point to educate them on the different types of carbohydrates instead of just saying you can't have any carbohydrates at all. So that actually leads us really nicely into the next question that I think a lot of patients might ask is, are there specific foods that I can eat that would help to stabilize my blood sugar levels?
Absolutely. And that's my next segue when I am educating a patient is rather than thinking of the foods that you can't have, let's focus on the foods that you can eat, right? What are those foods that have a minimal impact on blood sugar? And that's where the fiber comes into play. That's where the protein comes into play. And that's where those healthy fats come into play. So once we're able to talk about the differences and how they impact blood sugar, that also opens up a new segue and patients actually realize that they have more flexibility in terms of what they can really eat in comparison to what they can't eat. And it makes the experience less overwhelming.
Are there ever any times or are there any foods that we should keep on our you can never have list? Because I know patients want to ask this, what foods can't I have?
When I'm working with patients, I typically use the approach all foods fit, where I tell patients, if you are going to have something that is going to have a higher impact on blood sugar, we definitely need to think about how often are we eating this food, right? Are we eating this food every night or are we eating this food occasionally because maybe we're out at a birthday dinner, right? And once you reframe it in that perspective, it takes the pressure off from the patient from feeling like I can never eat a piece of cake ever in my life because we know that's not really true. And that's not going to be the reality in most cases. And now the patient doesn't feel like they have to constantly obsess over, I can't have this, I shouldn't have this. And now I want to eat this because I know I can't have that. So it definitely helps reframe the total approach from that patient's perspective.
Yeah, that's a good point. So talking about that piece of cake, right? So what are some strategies that we can provide our clinicians to help their patients try to avoid some heavy sugar cravings and maybe make some healthier choices?
Usually my biggest recommendation is really starting with asking the patient, what does your meal pattern look like throughout the course of the day? Because oftentimes when I'm working one-on-one with a patient, we go through the nitty-gritty of what their day looks like. And majority of the time, I notice that patients are skipping meals. And oftentimes that's what leads to those blood sugar roller coasters and heightens that urge to want to crave sugar because they're not necessarily eating consistent meals throughout the day. So definitely thinking about it from that perspective rather than thinking, you shouldn't eat this, you shouldn't eat that, but let's take a look, like, are you at least having breakfast, lunch, and dinner? And how long are you going in between meals without eating?
That's a really great point. I never really thought about looking at their time in between meals because that makes sense. If I'm hungry, definitely the first thing I'm craving is something sweet and easy. So keeping on the topic of sugar and snacks and sweet things, what are your thoughts on sugar-free items? Because I'm sure a lot of patients maybe come and say, I'm having the Diet Coke or this bar is sugar-free. How can we educate our patients? Is that appropriate? Can we suggest something else? What are your thoughts on those sugar-free items?
So one of the things that I like to highlight is that just because something is sugar-free doesn't necessarily mean that it's going to be carb-free. So that's usually the first segue when I am talking to a patient about a sugar-free alternative. And We know that sugar-free alternative is not going to have that additional added sugar. So I definitely agree with the fact that, do we want patients to consume these items every day in larger quantities? Probably not. But if a patient is used to drinking regular soda, switching to a diet soda is a better alternative because it won't have that added sugar.
Now, what are your thoughts about snacking throughout the day? Should our patients be snacking? What would some healthful snacks look like to maintain their blood sugar levels and avoid any of those highs and lows throughout the day?
And that's a great question. And it ties back to what I was referring to when you asked me about those sugar cravings and the importance of meal consistency. And those snacks do play a huge role, especially if you notice that you might be skipping a meal because maybe you didn't pack a lunch that day, or maybe because work ran a little over than what it's supposed to on a day-to-day basis. So that's where those snacks really come into play to help prevent that overeating. But you definitely don't want to snack on just anything. You also want to think about prioritization of that protein. And typically when I'm recommending a snack, I usually focus on your high protein snack. So let's say if we have a piece of fruit, what can we pair that piece of fruit with? So if we have that piece of fruit, having it with possibly a Greek yogurt will be a great alternative choice. And that's going to help stabilize the blood sugars a little bit better. So that way you're not having that significant rise quickly with the blood sugar.
So pairing maybe a carbohydrate like a fruit or maybe even chips or crackers or something like that with a protein is going to better stabilize those sugars. I think that's a great talking point that we can help our patients with if they do need that snack boost, maybe in the afternoon or in the early mornings. So I would love for you to leave us with one thing that you wished all primary care physicians would say to their patients, either who have had diabetes for a long time and are maybe struggling or are newly diagnosed. What is one thing that you just are like, oh, if the doctors and the PAs and nurse practitioners would just say this, it would make my job so much easier. What can you tell us?
I think the biggest thing is approaching it from a perspective that patient is most likely overwhelmed by this condition, and they're still going to have to navigate the food aspect of diabetes. And what we fail to sometimes realize is the major role that food plays. And we use food in many different forms, right? It could be a cultural aspect. It could be a form of celebration for holidays, right? I think when we approach it from a perspective of, it's going to be okay. We're going to get you the help that you need. We're going to refer you to that dietitian so that way you have the resources and the tools that you need. Diabetes has definitely come a long way, and there's so many resources and tools out there that help manage the condition more than what it did maybe 50 years ago. And that you can still live a healthy life despite a diagnosis. So I would say that those would be my last points in regards to being diagnosed with diabetes and knowing that it's going to be okay.
I love that. That's so encouraging. You know, it's not a one and done. This is the last conversation we're ever having. So I need to dump as much information to you as possible. I think having this open dialogue and walking hand in hand with them for years is so important. At what point do you think we should be referring to a dietitian? Do you think every person who is struggling with diabetes needs a dietitian, or maybe can some be managed with their primary care physician?
I think ultimately, when it comes to food, there's a lot of misinformation. So seeing that dietitian at the minute that patient is diagnosed is going to be extremely beneficial for the patient, because patients are also seeking social media or they're searching on the web for information, and they might be able to manage their diabetes for a substantial amount of time. But sometimes we don't know exactly to what extent. We want patients to implement a change that is going to be realistic and sustainable long term. And even though we might feel like that patient is doing great, we really don't know the ins and outs or the nitty gritty of their diet because we're not taking the time to ask those questions. And that's where, as dietitians, we come in and we're doing the nitty gritty when it comes to figuring out what they're eating, what their day-to-day lifestyle looks like, what are the resources that they have. All those things play a role in regards to food access. So it's very important to think about it from the perspective that nutrition is not black and white, and that even though we might feel like the patient knows, the reality is that they don't.
Yeah. And I cannot agree with you more. The importance of getting a dietitian on board, even if it's only for a few visits, but dietitians clarify so much, and you guys do have the time. You ask the right questions. It's so much different than when a clinician says, okay, here's a meal plan, follow this and good luck. And they maybe don't see them for the next 3 to 6 months. So I really agree with you. I think getting a dietitian on board is so vital. So I'm so grateful for this conversation. I really think this will be so helpful to primary care clinicians who are managing people with diabetes. And I hope that this will help our listeners. And we'd love to have you back on again. Madalyn, thank you so much.
Thank you so much for having me. This was great. And like I said, I'm glad to come on anytime and answer any questions. And I hope that your listeners find this useful as well.
That's awesome. And if you would like to connect with Madalyn, you can find her on Instagram at diabetes.rd. If you have any questions for me or for her and you'd like to continue the conversation, you can go ahead and message her directly at diabetes.rd, or you can find the Exam Room Nutrition Podcast on Instagram at Exam Room Nutrition. All right, guys, now it's time for my nutrition notes. In this section, I will leave you with a nutrition tip, an interesting quote, or an interesting case that I think might add value to your day. So today I'm going to leave you with a nutrition tip. And whether your patient has diabetes or not, I know a common question and issue that comes up a lot is the issue of beverages, especially when we are recommending our patients to drink 2 to 3 liters of water every day. That can get a little boring, and a lot of people just don't like the taste of water. So a couple of things that I like to do to spruce up water is recommend that patients can add some herbs to their water. Mint is an excellent herb to add to water. I really like to have it with some sparkling water and a little lime juice mixed in there. It makes kind of like a mojito mocktail, but it's a really great way to cool down and change up plain old water. Fizzy water is perfectly fine. There are so many brands out there right now that don't have anything added to them except for that little bit of bubble. And there are a few companies that do add 100% juice just to give it a little bit of flavor as well. So that's also an excellent recommendation to increase their fluid intake. Another thing that patients can do is to infuse it with fruit itself. So for example, you could put a few cubes of watermelon and some cucumber into the water bottle, and it just infuses the flavor into the water, and it makes it really crisp and refreshing. And you could do this with really any fruit. Orange slices, apple slices are an excellent way to do this as well. So get a little creative with your patients. If you are recommending that they increase their water intake, try to make it a little bit fancier and a little bit more appealing for them with those suggestions. Well, thank you so much for joining me today. I hope you found value in this content. And I would really appreciate if you could leave me a 5-star rating or even write a review in your favorite podcast app. This will just help other people discover my podcast. If you have any questions that you would like featured on the podcast, you can send me a message at Instagram at Exam Room Nutrition, and I'd be happy to feature that on an upcoming episode. Well, that's all for today, guys. And as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.